And I know many in our state are asking, when will it end? The answer is that's not on the horizon.
That was Governor Doug Ducey at his first news conference in 3 weeks, bearing the bad news. Coronavirus in Arizona is spiking for a second time as the holiday season arrives. This morning, we're turning to a former Arizona Health Services Director, Will Humboldt. He's now Executive Director of the Arizona Public Health Association. He's been closely following the pandemic since the very start. Will, good to see you again.
My pleasure.
Let's start with the holidays, and then we'll expand to the bigger picture. My family, we're still figuring out what to do for Thanksgiving at our house. Every year there's a big reunion of family and friends. Yeah. What are your plans for Thanksgiving, Christmas, the holidays? What do you advise?
So in my family, what we're doing is just having, my daughter's back from New York. She had the virus and she was recovered, so she's not an issue. So we're just going to have our immediate family here, just us. And then my parents are in their mid-80s and would probably go over in their backyard for just the pumpkin pie part of it and stay outside and keep our distance. So that's the way we're going to, manage that in my family. So it's going to be pretty small. One thing for people to think about maybe is not canceling Thanksgiving, but postponing it, until like April or something when, some of your higher risk family members will have an opportunity to get the vaccine. Just an idea. In any event, try to keep it outside, but the social mixing is going to have a real demonstrable effect on the trajectory of the virus, as we saw in the report from ASU's modeling team this week.
Yeah, let's talk about that. And I want to put some perspective on the virus today versus June, July, when we had that huge spike. You quote University of Arizona epidemiologist Joe Gerald in a recent blog post. I want to read from that. We are now entering a crisis, one in which we have little time to walk back from. If this surge is not quickly addressed, new COVID-19 cases will overwhelm our capacity to provide optimal hospital care within a matter of weeks. I recall Joe Gerald telling me almost the exact same thing in May or June before that surge. What is different, though, this time versus then? Because things have changed, haven't they?
Yeah, so yes, things have changed for sure. One thing that's changed for the better, I'll start with that, is that hospitals are getting better at and doctors are getting better at figuring out how to treat patients with COVID-19. Early on in May and in June and even in July, they were intubating quickly. That's putting a tube in their mouth, getting people on ventilators. They now realize that there are more strategic and effective ways of treating patients for COVID-19. So that's a good thing. The rest of the things are bad. If you remember, back in July, we were the worst state in the whole country. And so we had the ability, we being the hospital systems, had the ability to go out and contract with out-of-state nursing, ICU trained nurses, for example, to help manage patients within those ICU units and the general wards. That option isn't going to be available in December because the other states are already having a surge and we'll be having it at the same time. So that's something that's worse. Another thing is that in Arizona, we have a cyclical hospital system in which June and July every year in and year out, they're the months with the fewest number of people in the hospital. And that's because, people are traveling. We don't have the winter visitors here as much, but they return. They've already returned. And so December and January, especially January, are the 2 months of the year without a pandemic that already are close to capacity. So we're going to be adding these COVID-19 patients on top of an already naturally stressed system just because of our seasonality.
A lot of folks look at hospitalizations on the dashboard, the DHS dashboard, and say, come on, they're not so high right now. More people may be getting sick, but it seems fewer are being hospitalized. Is that a trend?
Well, the trend is that we're on an exponential growth curve for COVID-19. I mean, that's what's happening. Now, remember, if you look at the state health department's dashboard and you look at the capacity there, their denominator, what they're looking at in terms of total beds is licensed beds. That's licensed beds. I know, I used to run that agency. Licensed beds is way different from staffed beds. And so you could be, for example, at 93%, 92% of licensed capacity, but in terms of staffed capacity, you're way over 100%. So, you have to look at that dashboard with a grain of salt in a way. The trend is something worth looking at, but staffed beds is different from licensed beds.
There's also a demographic trend. Younger people under the age of 20, more of them are getting sicker. What's going on there? Why is that happening? And how sick are they getting?
Well, so let's start with the similarities with June and July. The same thing happened in Arizona, by the way, demographically in June and July, where we saw the first spike in cases among folks that are in their 30s and then 20s and 30s. And then that began to spread into these other demographics that have more debilitating medical conditions that put them at higher risk. I think all in all, the healthcare system is getting better at treating people of all ages. And so that, as I mentioned, that is something that's encouraging and better than what we saw in June and July. But of course, people in their 20s and 30s are at risk for having a bad outcome. And that's one of the things that makes this virus so scary, is that it seems to strike like lightning, where somebody who's a marathon runner, for example, in their late 20s can have a super bad outcome. And, others don't even know they're sick.
Is that a function of students going back to school? Those lower, the age group?
Yeah, the age group
being affected?
I don't think anybody knows for sure. I think it's a combination of things. I think part of it, well, I would say back in September, that was from the universities coming back in town. But all three universities did a terrific job at managing that. And we saw a pretty precipitous decline in people, young adults, in cases after those universities, were fully able to implement their plans. That's part of it. In my opinion, a lot of it is, poor enforcement of the existing expectations for mitigation measures in bars, restaurants, and nightclubs. Now, we've got existing mitigation measures in place, and I think they're good ones. But if you don't enforce them, then they don't exist, really.
Okay,
I think that's a portion. And then, as Dr. Chris said earlier this week, it's the get-togethers, it's partying, it's people seeing one another, that social mixing at the granular sort of friend level.